Good afternoon, Team Edwards. Chief Ward-Swanigan here. We're joining you a little bit delayed, but better late than never, right? As our awesome PA team is making miracles happen behind the scenes. Today, I'm joined by Air Force Test Center Command Chief Brian Stafford, and I also have with me Airman Powell from the Wing Command Section, as well as Captain Hathaway, one of our local Space Force Guardians who comes from the 461st Flight Test Squadron. So some of you may be wondering, where's General Higer or where's Colonel Gordon? That's actually a good question. They are following protocol and they are in isolation at the time. As we know, Omicron is highly transmissible. So they're doing the same thing that I had to do a couple of weeks ago when I was infected with Omicron. Despite all the measures that we've taken, the smarts, following all the protocol, wearing our masks, washing our hands and whatnot, we were still somehow, infected with COVID. And so we improvise, we make it work, and we move on. That's kind of just the nature of where we are right now. And so just wanted to talk to you a little bit about today's topics and what we're going to have on the lineup. We're going to start off with an Mlk Observance, talking a little bit about the holiday. We'll get some perspective from our guests, and then we'll kick it over and check in with Chief Stafford here to find out what's on the horizon for the test center. Of course, after that, we'll bring in our local medical SMEs, our subject matter experts, so that we can talk COVID. And as always, we'll take questions. So the number will pop up here in a second here for you to text your questions in as we're going through the script here. So as you all know, we had a 4-day weekend recently, and while we had the day off on Friday, Monday is more of a day on in observance of Martin Luther King Jr., Dr. King, and what his legacy is all about. And so kind of wanted to jump into that a little bit. Our PA team did an awesome job of putting together a roll-up of his quotes, his achievements, and just kind of highlighting the importance of that day. Just wanted to, give you a few of my thoughts and then get some perspective from some of our guests on the same subject. So, as he's the most influential African-American civil rights leaders of the 60s, when you think of the Civil Rights Act of 1964, the Voting Rights Act of 1965, the Supreme Court ruling back in the 50s when Rosa Parks refused to give up her seat on the bus, his efforts were instrumental in all those things. And there's so much more to Dr. King's legacy. I mean, he's done, astronomical things, and it's just hard to really do justice by, kind of highlighting and summarizing what he's done. Most people know him for his "I Have a Dream" speech, and that's kind of like one of the most notable things that he's known for. But it's so much more to it than that, when you talk about civil rights, equality, justice, just making the world a better place for all people, regardless of their race and their color. He won the Nobel Peace Prize for all of his efforts, and I can distinctly remember going through school, and each year, and as history would have it, we would talk about MLK, and you would hear about all the greatness and all the service, the selfless sacrifice that he poured into this world, if you will. And then for that to be abruptly ended when he was assassinated in 1968. It's just really, to me, the holiday is a reminder, a day of service for all of us to do our part and uphold his ideals, and just pass that on from generation to generation so that it's never forgotten and so that he didn't die in vain, if you will. And so I won't necessarily hog the stage on my personal opinions. I would like to hand it over to our guests, Airman Powell and Captain Hathaway, to kind of offer, your thoughts on the subject of MLK Day, what that means to you, maybe an experience or just your thoughts on the situation of those times.
Awesome. Thanks, Chief. I guess I could jump in first and just speak to the thoughts I have. When I think of MLK and MLK Day, kind of two things come to mind for me. And unfortunately, I was on isolation for a good part of the past weekend. But something that MLK I know did a lot of, obviously, was public service. And so I was very proud of a lot of the initiatives that went on in the local area to include folks from my squadron going out and doing volunteer work, helping out the local community. Things like that, I think, really helped carry on the legacy and some of the initiatives that MLK was trying to get after. Another thing that stands out to me is, we take a day each year to kind of reflect on the history and the great things that MLK did. And I think it's important to not necessarily dwell on the past, but recognize some of the challenges that we had to face as a society and the things that we had to deal with back in the 60s. And recognize that where we are today is really due to a lot of not just MLK, but other very significant figures in our history during the civil rights movement to get us here. And it helps us recognize, we all come from different backgrounds. And as a supervisor, that's something I try to take to heart and make sure I really understand where people are coming from so that I can do what's best for them and keep pushing the ball forward. So it's kind of the two things that stand out to me when I think of MLK Day. So I'll pass it over to you, Emrin Powell.
Yes, sir. Thank you, Captain. So why it's so important to me is a sense of pride from where we came from and where we are now. So it's important for me to utilize those things that was given to me early on. So that's it for me.
Awesome. Well, I appreciate that perspective, and I think you two make some really good points. You really have to reflect sometimes on, the path that was laid for the rest of us, and then for us to continue that and to try to make sure that, future generations are afforded the same thing. And I think it's another point that was made when PA sent it out. If you haven't had an opportunity to read the email, there's some really good information in there about MLK, what he stood for, and some of the things that we're talking about. Nonviolent social change is a big highlight, and community, if you will. It talks about the beloved community and how it's a global vision for all people to be able to share the wealth of this earth. And I think that summarizes it well. When you talk about poverty and hunger, homelessness, prejudice, racism, discrimination, you name it, stamping all those things out, those barriers that kind of get in the way of us advancing as a community globally. I think that those are the kind of things that we need to focus on and to promote and advance, if you will, so that we can continue that legacy and uphold those ideals, kind of like I said before. And so with the subject of community, Brian, and then just based on some of the things that we're saying, would you mind offering your thoughts on the scenario, and then,
Sure.
Going into maybe the community aspect of why you're here and what's going on with Test Center?
Yeah, so obviously with Dr. King's beloved community, I mean, it's so vitally important, as you mentioned, with, whether it's hunger, homelessness, civil rights, for us being in the center of the aerospace test, universe, there's also kind of, if you want to go to the home of civil rights, I encourage you to take a trip down to Montgomery, Alabama, because that's really, it's the home of the Air Force, right, where we do a lot of our professional military education. But there's so many different museums and activities that you can do. I mean, Tuskegee, Alabama is not too far away, so you can go visit there. There's a lot of civil rights museums. Dr. King's home that he lived in the 50s is still there. Right. This past July, I had my first opportunity to go and just see some of those things and try and work it into my schedule. Didn't have certainly as much time as I would have liked, but certainly just to go and kind of see some of those things, it really hits you hard, and just to realize, and understand how important those factors are. And so if you ever have a chance to get out there, to, whether you're going to NCOA Academy or, Maxwell for SOS, Squadron Officer School, I just encourage you to schedule that later flight to go and maybe take advantage of some of those opportunities and just take a look there.
Yeah,
and
to
see.
piggyback off of that and what the captain was kind of talking about, taking that day to kind of volunteer and give back, if you will. When we went through PMA, some of my friends and classmates, if you will, went over to Selma and they drove over
Yes.
to check that out. And so I agree with you. Museums and documentaries, there's so many things, so many resources out there. I'm not always able to volunteer, but I do like to take that time of year to reflect and maybe pull up a documentary and just kind of look at some of the things that he went through, that they went through, that they were fighting for and that they accomplished. And if you look at what was sent out by PA, there's a couple of quotes on there. And a couple of my favorites were, "Hate is too great a burden to bear. I've decided to love. Let no man pull you so low as to hate him." And one other one that's not on the list that I got from a documentary called King in the Wilderness was when they asked him, "Do you fear for your life?" And his response was, "It isn't so important how long you live. The important thing is how well you live." And I think that the values and the morals and the goodness of what that, kind of centers around is similar to our core values and what we do and the reason why the Air Force and the Department of Defense, if you will, those things that we kind of have at the core kind of make that, it kind of aligns really well. And it's just, like I said, a day to just kind of give back and look into that a little bit
Right.
further.
Certainly as military members or non-uniform, civilians, that we obviously provide a service to the nation, and it's just great to see us going out and contributing in other factors, in other ways in our communities, whether it's Habitat for Humanity or working at a shelter or some other venue.
Right.
I think all those pay homage to the efforts of Dr. King and some of the other civil rights leaders.
Agreed. No, I absolutely agree with you. So, like I said, just wanted to take a few minutes to, highlight why we were given a day off. That day off is because of the day on, if you will. And so that 4-day weekend, it's not about just, having some time off, but it's also a call to service for Americans and folks around the world, even internationally, to reflect on how far things have come and to, continue to pass the torch, if you will. And so with that, that's it for our segment on MLK. I'd like to thank our airmen and guardians, teammates over here for coming over to share their perspectives with us. We really do appreciate you taking the time out of your day for that. And with that, I think you have some other goodness that you wanted to share with us.
So I wanted to, obviously with, the efforts when you look at community, right? So one of the topics and for this quarter, for the Air Force Material Command Connect program, it's all about community. And so each month has a specific theme, but March, we're targeting the theme of community. And so I've had the great fortune of working with and seeing a lot of presentations by Ms. Kristen Christie, who speaks on resiliency and the efforts of community and kind of just that connectedness to your surroundings. And so I've asked her to come out. She's going to do some presentations for the Air Force Test Center. Certainly she'll come out here to Edwards, but we're gonna broadcast that out to the Air Force Test Center Enterprise, so everybody can take advantage. So regardless of which base you're at, we'll be able to broadcast that out. And so I invite everybody that's listening. Right now we're targeting the 1st of March, and so I'm not sure exactly what forum, but I'm sure we obviously have a lot more town halls that we can push that information out. But everybody just to tune in, because her message is so inspiring and so powerful.
Sure.
I think we can definitely get a lot out of that. And yeah, if there's anything that we can do to help support the community, we're always looking for those opportunities.
Awesome. I think they label her as America's Resilience Speaker.
Correct, yeah.
That's a big title.
Yeah, it is. And like I said, it's a very inspiring message. She's actually been pushing for kind of a National Day of Resilience, which is March 4th. And so she talks about March 4th and Conquer. And so, it is it's fantastic that it really lines up for that week.
Sure.
Unfortunately, she won't be able to be here for the 4th. She has some other commitments, but that doesn't stop us from being able to champion some programs and some opportunities that we can get together within our community and kind of just connect together.
Sure. Okay. Awesome. Well, hopefully you don't mind sticking around and just kind of hanging out
No,
with us
fantastic. Thanks
for
for
the rest of
having
the segment. But at this point, we'll start by talking a little bit about HPCon Charlie, because that's something that happened recently before the break, and then we took the 4-day weekend, and so a lot of questions have been surfacing about why we would go to HPCon Charlie, or as some people call it, HipCon Charlie. The reason we go to Charlie is to prevent us from having to go to Delta. So I hope that at the very least people understand that we are taking these measures so that we don't have to go into Delta. And with what's going on around us, the surge and all these easily transmissible cases, we can't ignore those things. And so we have to change our posture. But what I wanted to highlight about the transition to Charlie is that HPCon Bravo, Bravo Plus, and Charlie, the base access does not change between the three. And although there's going to be some limitations on occupancy, you're going to see some commander discretion in some areas on how many people based on the smarts and what's going on with the mission, those kinds of things. We close indoor dining, telework where you can. Those sorts of things are the focus. But I think one of the highlights from our latest installation command directive was being vigilant and remembering to do the right thing and, wearing your masks and continuing to fight through this. I know a lot of times people get COVID fatigue and they start getting to the point where they're tired of wearing the mask and they're tired of doing this, that, and the other, but we cannot let up. And so I just wanted to highlight that we got to remain agile and vigilant. And so I think that a preface with HPCon Charlie is the perfect segue to turn it over to our medical professionals. We have Colonel Westy and Major Vrooman here to talk about what's going on here recently with COVID.
Hi, everybody. So yes, our COVID definitely, we are definitely in the surge still. We may have reached the peak, hoping, because our numbers are starting to go down just a little bit, but unfortunately we are still definitely in that peak surge. We are still seeing a lot of cases coming through. Omicron is definitely the predominant variant, and it is very, very infectious. So just to highlight, it is still going around. We are still definitely in the surge. All the mitigations that we're trying to do is trying to calm down or trying to get us down a little bit from a peak and not have it go up again. But of course, when we lose the mitigations, we definitely will be higher than we are right now in terms of peaking cases. So we are definitely still in a surge. Hospitalizations are still, hospitals are still overwhelmed right now with cases. So that is a definite concern. The majority of cases, or the majority of people who are hospitalized, are unvaccinated. So it is still kind of a pandemic of the unvaccinated at this point. So about 90% of those who are hospitalized right now in AV hospital are unvaccinated on a ventilator. So it is really important to make sure that you are still getting your vaccine and getting that updated. But of course, it is still important to make sure you are wearing the mask and doing all those mitigations to kind of prevent hospitalizations and death. And unfortunately, we are seeing death rates increase as well. So usually death rates will have about a 6-week lag. Obviously, when you get sick, you may end up in the hospital. People try to take care of you, so it takes a while. Sometimes it takes a while for us to see that death rate rise. But we are definitely seeing it. I think in the US, we had about a 44% increase in the last 2 weeks. So we are definitely seeing people dying from COVID. Again, if you're unvaccinated, that is definitely of higher risk. If you're not fully boosted and it's been a long time since you've gotten your vaccination series, like if you got it back in March or something of last year, you may not really be as well protected. So it's very important, especially if you have any kind of comorbid medical conditions, or if you're older than 50, to make sure you do get your booster and you're fully vaccinated. But unfortunately, the Omicron is not a mild virus and mild variant, as I think continues to be advertised. It is definitely something that can still kill people, and it is causing deaths. It is causing increased hospitalizations, especially in kids. So that's another huge point, that this is the highest we've ever seen children being hospitalized. We are seeing record numbers of kids getting cases. If you talk to any school nurse right now, even in our local area of California, they're going to tell you that they have been overwhelmed with numbers of cases and contact tracing and testing of kids, and kids being out of school at this point because they are getting infected. And the little ones are really getting infected. Unfortunately, Omicron really concentrates on more the upper respiratory system, and little infants are definitely getting infected a lot more with that. So we are seeing a rise in hospitalizations for infants as well as children. So it is really important to continue to make sure we are vaccinating and mitigating as much as possible to protect our kids as well. There was some latest research. Over 25% of the cases right now are in children 0 to 18 years of age. So that is still a pretty good number of kids that are getting COVID. We don't know the long-term consequences, even with Omicron, of long COVID syndrome in kids. So it is really important to protect everybody at this point. And then obviously the guidance has changed for mask wear. As you can see, I've upgraded my mask to N95, so this one's an N95 mask. There's a lot of guidance out there if you go on the CDC website for updated mask recommendations. The recommendation is really, at this point, the cloth mask probably isn't good enough to kind of provide protection. Really recommend upgrading your mask wear. But at any point, any mask is better than no mask. So that's probably the number one rule. Any mask is still better than no mask at all. But a well-fitting mask is better than a loose-fitting mask. And then if you can upgrade to a surgical mask with a cloth mask, that's even better. So as Major Roman is demonstrating, he's got a surgical mask underneath and then a cloth mask over. So that's the double masking. Even if you did a surgical mask, as long as it's kind of well-fitting to your face with no gaps, it's over the nose, underneath the mouth, the chin, that is going to be better than just a cloth mask alone. And then there's other versions like the KF94 and the KN95. I have my kids that I brought just to show that it does come in kid versions as well. So they're a little bit lighter to wear, but they have better filtration. But as long as they're wearing it, right, that's really still the first issue, is making sure they're wearing it well. And then the N95s. These are actual respirators. So if you're in an occupation like healthcare, where it is a required PPE, then you do have to be fit tested for it. I am going to say it is a little bit harder to wear. It's a little bit more uncomfortable with kind of increased work of breathing when you do wear it. So a lot of times we do have to medically clear people for a respirator. But this obviously is going to be better in terms of protection than just a cloth mask alone. So, but there's different grades of masks. But again, number one rule is wearing that mask and just making sure there's no gaps. That's really the priority of a well-fitting mask. But there are different versions out there that you can get from different websites as well. But the CDC is recommending upgrading. If you are just going to wear a cloth mask, make sure it's at least 3 layers. And it's well-fitting where there's no gaps. So that's a huge recommendation. I know there's some guidance that are out there for that. And then just a reminder for isolation quarantine guidance that's out there. The base is following the CDC guidance that's out there, with the only caveat that if you are trying to if you're trying to end your isolation earlier than the recommended 10-day isolation period, you do have to have a test to be able to do that, an antigen test. So the criteria is if your symptoms are pretty much gone by the 5th day of illness, and you have a negative antigen test, and you can wear well-fitting masks for the next 5 days, then your risk is probably low enough that you may be able to end your isolation earlier than 10 days and go back to work and things like that. I am going to say that I am going to push for a huge caution on that. We do know from science that 30 to 50% of people at 5 days of illness are still contagious, are still infectious. And so just bear that in mind. Even the folks that have come in through our med group, we kind of did a little bit of a analysis of when we did have antigen tests available, and it was about 40% were still positive. So I'm going to say that, you know, if you, I would rather people just do the 10 days of isolation and call it a day than try to do a test. But again, if it's something where it's really critical for you to be ending your isolation early and you really don't have any symptoms at 5 days, you can try to do that antigen test if you can get one and be able to end your isolation earlier. But really, it's still a risk, and it's preferred just to do the 10 days because that's a very definitely decreased chance that you would be infectious after 10 days. You don't have to test out of isolation if you've done the full 10-day period. Quarantine guidelines do change with if you're boosted or if you're, so definitely I would recommend people get boosted or get up to date on their vaccination. Up to date means that you've had your full vaccine series for the mRNA booster, mRNA series at least in the last 5 months, for the Johnson & Johnson at least in the last 2 months, or that you have been boosted. So that really is a up-to-date vaccine. There is a CDC website that does show if you want to know if you're updated on your vaccine. But I do highly recommend that, because if you are up to date on your COVID vaccine, if you are exposed to somebody, you don't necessarily have to stay home. You still are recommended to get tested at day 5, but you don't necessarily have to stay home. So just keep that all in mind. And then just going for tests, obviously in the news was about that the federal government is providing 4 tests for each household. You do have to go and sign up for it. Very, very easy process. You don't have to put there's no credit card or anything like that. You just basically put your name and address, and they will send it to you. So I'm gonna look at my notes real quick. So that number, that website that you would go onto is covidtest.gov. So if you go onto covidtest.gov, you can register for your 4 free home tests for COVID. So definitely have that, just to have in case you do feel like you have symptoms or you're that's a good test. Testing is really, really important right now. And the more able we can test, the better it is, especially if there's any kind of concerns about being exposed to people, or if you're feeling sick and you're just kind of wanting to know. Do keep in mind that that any test can have false negatives. So if you are feeling sick, really the best thing is to stay at home and not go to work, not go out until you really know how you're feeling. So, or if you got a test. So really there are a lot of false negatives with these tests. So with the antigen tests, like those at-home tests, they do recommend you have consecutive tests. So if you're feeling ill, do the test. If it's still negative, take another one, do another test in like 24 to 48 hours. And if that's negative still, then you're more likely not to have COVID. But those tests are designed, there's 2 tests in each kit, and that's the reason there is because you really do need those consecutive tests to really know if you have COVID or not, because there are definitely false negatives with those tests. There are also false negatives with PCR tests, but a PCR test is more likely to catch someone with COVID than the at-home test. If your tests are positive, you are positive. Right now, with how the community prevalence is of COVID, there are no false positives. So just pointing that out. And then vaccine update, again, get your vaccines, especially if you have, for your kids, make sure your kids get vaccinated. Vaccine is available for 5 and up. Definitely is important, especially in our teenage population. They're interacting with other kids a lot more, and they are, again, more likely to be hospitalized and possibly, have long COVID issues or even dying from COVID. And you want to do everything you can to protect your kids, and really getting that vaccine is extremely important. Kids can get boosted, so 12 and older, if it's been more than 5 months since their Pfizer vaccine, for 12 and older, they can get a booster, and that is really still highly recommended to go ahead and get that. So the vaccine, again, very, very important to get. There's a lot of studies right now that are looking at boosted versus fully vaccinated without the booster, and unvaccinated. And if you're boosted, you are 5 times less likely to get COVID than if you're unvaccinated. So that booster is definitely recommended. There was some data from Nebraska that I had pulled out that said that If you're fully vaccinated, you're 11 times less likely to be hospitalized for COVID-19. But if you're boosted, you're 46 times less likely. That's a huge drop in risk if you're boosted. So do get your booster. Your booster is very, very important. So I'm going to leave it to Major Verman to kind of talk about what Med Group can offer you guys.
All right, so I don't want to rain on Lieutenant Colonel Wesley's parade about the vaccine, but the first thing that I'm going to share is some bad news regarding the vaccine here at the Med Group. You may have gotten an ad hoc message earlier this week with some updates. Due to some guidance that was dropped by the Defense Health Agency earlier this week, the Pfizer vaccine, which is the only one that we had in stock, is now being restricted in use. So any appointments that have already been made, and that includes ones on the 2nd of February, so next Wednesday, will be honored. However, we have pulled all remaining appointments from the website, the appointing portal, until we're able to get more stock on hand. I expect that will be in time to resume on the following Wednesday, the 9th of February, uninterrupted, but I do not know that for a fact. So just keep that appointing portal link. It's going to be right there in the same place as always. Right now, there's a page apologizing that we don't have vaccine available. Whenever we have appointments, it will function as normal, and you'll see the appointments there again. One thing that I do want to mention about that, the pediatric vaccine, so that's the one for 5 to 11-year-olds, that is unaffected. So we still have plenty of that. Those appointments are every third Thursday, and again, accessed through the same DHA appointing portal link. On the subject of tests, so similar bad news on that front. We had the antigen test, and as Colonel Westy was saying, that's what you use to test back into work out of isolation a little bit early if your symptoms have decreased significantly or gone away. We had some, and we used our entire supply in about a day and a half. As you can imagine, that same demand has been about the same across the country, so the supply chain has been interrupted, and we've missed 2 or 3 expected delivery dates now for a resupply. We will be in communication whenever we get more supply on how or if that's going to be accessible. But for now, we just do not have any of the antigen tests available. So if you're trying to test out of isolation, we cannot provide that service at the Med Group at this time. Now, as for any other reason to test, that has been uninterrupted. We've got plenty of the PCR tests, so those are the ones that are going to pick it up if you've had it any time recently, to be honest. So please just be aware that we still do have the testing clinic there from 7:30 to 11:30 for drive-through testing. But testing out of isolation is not available until you hear differently from us.
Major Vrooman, just for clarification purposes, when you say restricted in use, can you clarify that that's because of the limited supply and not any other reason?
Yes, ma'am. So that is the reason. Defense Health Agency had some concerns about, I believe, the total DoD supply and their ability to meet the need for uniformed members. So that is why they just put a pause on using that vaccine for anyone who doesn't wear the uniform, and that's to conserve the supply for uniformed members. Likely, when we get more in stock, it will be the Moderna vaccine, so that restriction will not apply. That is what we intend to resume administering in the next couple of weeks here, would be the Moderna vaccine. They have no such restriction on that, so we can go forward with that as soon as we can get it in stock.
Awesome, thank you. And then, ma'am, one clarification on what you mentioned about testing out, and then you piggybacked on asymptomatic people test out.
Yeah, I'm gonna push more for that. I mean, that's not, the guidance is significantly improving, but like I said, I have seen a lot of people still test positive, and honestly, it's trying to test viral load, right? If you still have a lot of secretions, runny nose, all that stuff, most likely you still have a pretty good viral load, and you're going to test positive on that antigen test anyway. So, just to kind of make it more likely that you're going to get a negative test, if you really don't have any symptoms and your symptoms are pretty much gone, like you feel like you're pretty much recovered, you're back to square one, 100%. There's more likelihood that antigen test at 5 or 6 days will be negative. But I would still, like I said, if you're having any kind of symptoms, especially kind of a runny nose, sore throat, things like that, there's still a very good possibility that you still have a high viral load, and it's pointless to test at that point. So, and again, there's still a possibility that you could still be infectious even if you don't have any symptoms. And they've had a couple of studies in the United Kingdom. There's a study recently with the NBA basketball players where they were really showing that people were still infectious at day 5, and their infections, actually your infectious period was still 10 days versus Delta, which was maybe 11 days. So it really did not. Omicron isn't like it goes away it's not like it goes away fast or anything like that. The guidance from the CDC really, I think, changed more for trying to get, people back into work and things like that, more than because the disease kind of suddenly got better. So it really is still something of caution. Even in the United Kingdom, their guidance is that you test twice. So again, I was talking about Antigen Test, doing 2 consecutive tests. That's what they're doing. You test on day 5, you test on day 6. If both of those are negative, you can go back to work on day 7. So again, we're being a little bit more, California is being a little bit more conservative, and so is the installation, because it is so much risk, I think, to put somebody back into the workplace that could still be potentially infectious. So that's why we are requiring or pushing for that. If you definitely need to go back and you really have no symptoms, hey, get that test. If that test is negative, then that's more likelihood that you're probably not infectious, and that decreases the risk level for the work.
Okay, I do want to get into the questions from the audience, if you will, the virtual audience. But I do have one quick question. Is there anything in the research that suggests that if you're boosted, I'll use my example, my situation as an example. I was positive for COVID. On day 5, I had an antigen test that was negative. Is there anything in the research that suggests that might be because I was boosted?
Oh yeah, definitely.
And that's like
that definitely is that if you're fully vaccinated, like you have good vaccine kind of immunity, boosted, you're probably able to clear the virus a little faster than if you're unvaccinated, and thus you're less likely to be contagious or transmit that virus. So there has been some studies that do suggest that, definitely.
Awesome. Thank you, ma'am. Jeremy, what do we got for questions? Nothing?
Nothing yet, Chief.
All right. Well, we have a special guest here from the MSG who usually holds it down for us. Colonel Harris, do you have anything?
Yeah. Is it picking me up? Do
No.
we get a thumbs up from those guys?
Yeah, you're good.
Okay. So when we talk about the testing out of quarantine that the clinic can't offer for active duty folks or even civilians on base to test out of quarantine, the school
Test out of isolation. Sorry,
test out of isolation. The school actually is offering, or will be starting, a clinic that they'll be running from 11 to 1 for the kids to come back out of their isolation whenever they test positive for COVID. So that's something the school district is kicking up. They test run it at Boron schools, and it was successful. So they're going to start doing it at our schools starting next week.
Awesome.
Yep.
That's good news. Anything else, sir?
No. I mean, there's been a lot of cases for the CDC and the school age annex. The CDC is back. They're back to work. We took a week off. We shut down the CDC, and it was much needed to clean and give the workers the much needed rest time to get out of their isolation as well, because we had a bunch of workers that went down.
Sure.
The school age annex is now getting hit pretty hard, but they're managing to stay open with the caregivers that they have, especially in light of the new guidance of testing out of isolation. So there's a couple of rooms that got hit with some close contacts, and we're trying to mirror the school and work closely with the school to make sure that the kids that get to go back to school also get to come back to the school age annex. So there shouldn't be any confusion on that part. So as far as testing, you do need to go to the school to do the test. They don't want you to do an at-home test and then take that to the school. Mm-hmm. They'd rather the nurse at the school do that. That's why they're doing the clinic, so that they can make sure that the test is done right and there's no errors with it. I would caution any parents listening, if your kid tested positive and you were told, or had close contacts and you were told to keep your kid out of school, please keep your kid out of school. They have had instances of people still bringing their kid to school, even though they were told not to bring their kid to school. You're only going to infect other kids. So just a word of caution to any parents listening. Other than that, that's all I got, Chief, unless any questions come up for MSG.
Yes, sir. Thank you for that. Jeremy, anything?
We did have one question, Chief, and I think it'll be for Colonel Westy. There's a mention of a surge in Europe of a silent Omicron, which is apparently is a variant that doesn't show up on tests. I don't know if there's any data on that currently.
I haven't heard of that, but I could definitely look into it.
I haven't heard of that either. If it doesn't show up on tests, I do wonder how they found it.
I don't
That is
think
a good
anybody
question.
would hear of it because it's silent. You know I gotta be goofy. Hey, he laughed. I guess that's it then. No questions. Brian, what do you think? Anything else that you want to bring up about Test Center? What's up on the horizon, or anything about Omicron, or anything else that we're talking about?
I don't think I'll get into the COVID business. That's not really my specialty. So,
Right.
But yeah, there's obviously, I think the biggest thing is, everybody just making sure that we're taking calculated risk and making sure that we're doing the right thing, not infecting, others, or, whether it's children, staff members. It obviously is having an impact. I know, a lot of people have gone back. We're still continuing to do telework. So I think there's still be more refinement in that process and how we do that. For example, the Air Force Test Center, right, where the building 1 is under renovation, and so we've kind of adopted a hoteling concept where, once we do come back, there'll be desks that aren't specifically given to individuals, but that allow them to still telework, and then when they do need to come in, they'll have a desk available and that sort of thing. So we're really getting after that and trying to adopt those types of things to continue to protect the force.
Awesome. Any lessons learned from Eglin or Arnold that you've heard about that maybe the Edwards folks or Team Edwards could take a page out of the books of?
So to tell you the truth, between when you look at the data from each of the locations, I would say that the Edwards does a really good job. Each installation in their own right, but when you look at the local communities, each one is slightly different.
Sure.
And so I think I would say that the ones that we see that really do kind of stick to the protocols, stick to the mask wear, stick to the solid hand washing, I think those are where we're seeing some of our lower numbers. And so, yeah, just continue to get after that.
Awesome. No, that makes sense. Jeremy, anything come up yet?
There is one other question of any forecast of going into HPCon Delta, but I believe you did answer that, Chief, of we're going into Charlie to prevent foreseeable Delta.
Absolutely. There isn't, that's something that you really can't predict. We didn't really predict any of these. We just kind of go with what's happening around us in the local areas. And I think our medical professionals, as they get smarter on things that are happening and we kind of put all that data together, that's kind of what drives it. And so it's really going to be based on, local community. And I think the surge has a lot to do with the holiday season and how we had a surge each year so far. And we're just trying to get on the other side of this current surge. I have not heard of any forecasted measures or forecasts to take us into Delta. So yeah, nothing on that at the moment. I think is that it?
That's it, Chief.
Wow, it's quiet today. What's going on, Team Edwards? They're usually a little more, engaged, but I guess maybe, people are just, ready for the weekend maybe. I'm not gonna force us to hold to a full hour at that point. I just wanted to plug that the boss and I recently were on a California Commanders Caucus where each of the 6 installations, Department of Air Force for California, all kind of got together virtually and in person to kind of talk about some similarities, some things that we see different from installation to installation, to kind of compare notes and to see, where we can come together to kind of advocate for what our airmen and guardians need. And so that's kind of like the most recent thing that we were involved in. And one of the topics, in case you're wondering what that consists of, was the fact that California still taxes military retirees. So looking at how do we try to get that changed, as there's like 20 some bases states that do not tax military. And then recently there were 5 additions to that, and California was not one of them. So, hey, how do we, get that information from all of us as a united front to kind of advocate that, hey, what do we need to do here in California, or why isn't California included? Another big topic was the spouse employment reciprocity. As you all know, there's struggles with that in the area, and I think that affects more than just California, but specifically that's one of the topics that was brought up, and we had the Governor's Military Council, Governor's Military Council with us, so that they could take our inputs and get that in the hands of legislators that can actually make some change and do something about some of the issues that we kind of face here. But other than that, I don't know, other than kind of what we talked about here with MLK, and we had a good segment with that and had some guests on the subject. We had our experts here from Med Group and a surprise visit from MSG and an awesome visit from the test center. You got anything else?
So I know one of the other things that we've obviously dialogued a lot in the last few days is the upcoming change going back to the relief that we've had over the temporary lodging expense.
Ah, yes.
And so just a reminder for the audience that authority, that temporary authority that we had to kind of balance the rates will expire on 1 February.
Absolutely.
And I know that the test wing leadership is heavily involved in trying to find different avenues to